And a good example is that we found that when we did the early immunotherapy programs, this immune stimulant, and this had low dose interleukin 2, etc. We found that some people responded fantastically to this, but the majority didn't. So we spent that. The question is why? Why did this patient do so well and this patient not? And the answer was so unbelievably simple. It occurred when they rolled out really reliable assays you could do quite quickly for vitamin D. And there it was. The only people who responded had good levels of vitamin D. The majority who didn't had low vitamin D. So we began correcting the vitamin D and our response rate went up. I mean, it's these simple things. I went to NICE with senior colleagues. It's well over 15 years ago, possibly more, with all this evidence to say that they should make it absolutely mandatory that everybody gets the vitamin D checked and it's brought up to high levels before you start treating. Because if it's low, you will not respond to chemotherapy. I mean, my colleague Daniel von Hoff, big pancreatic cancer trialist in America, I mean, he kind of laughed at me when I put this out and then phoned me up 3 months later and he said, I've been through our records. He said, nobody responds to chemo in pancreatic cancer if their vitamin D is low. He says, it's unbelievable. So we're now correcting it. And we told NICE this, the most inappropriately named organization since SAGE. And there are many others. But I mean, they might as well talk to keepers at the zoo, really, is all they're interested in. And they said, oh, we'll put it on our 5-year plan. Well, that 15 years have passed, and it's there only as advice for nutrition. It is vital for your immune response. And this is what annoys me. All the people at the top of these organizations are, to me, are idiots. They do not think of what happens in the interface between the patient and the clinician. They're too high up there in the clouds and elite. They think it's not important enough. They will get involved if Pfizer or somebody comes along with a new drug that costs $100,000 a year and is very toxic and works just in a few people, then they get very excited. But if there's something that's really cheap, non-toxic, has a mega effect. And I would have thought that was part of the NHS's role. And they clearly don't take their job seriously. I mean, I will levy that. I think to have all these patients come to me who fail various chemotherapies and things, and no one's taken their vitamin D level. I take it and it's in the boots. And I said, you shouldn't be allowed to start out on a course of therapy, chemotherapy, immunotherapy, unless you've had your vitamin D corrected. The data is that black and white.